How long does it take for a tibia fracture or broken leg to heal? And how long does it take to feel normal again and to play sports or exercise or go back to work? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. I'm making this video as part of the Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. And there is no question, questions about tibia fractures are some of my most common. Now, when I say tibia fracture, I'm talking about the long shin bone. This is a knee model, so it doesn't show much of the tibia, but it'd be the long part of your lower leg. This is not meant to be the fibula or the small bone on the outside of your leg and the outside of your ankle. We're clearly talking about the tibia. Now, occasionally these tibia fractures can be treated without surgery, but in adults, that's almost unheard of. Typically, those are kids that do that based on how they heal and a number of different issues. Adults almost always need surgery. That may be a rod that goes down the center of the bone, especially if it's a clean break, just two different pieces break straight through. Or it can be a plate and screws, and you see that a lot when it's broken into multiple pieces, but some of that a little is surgeon preference as well. Typically, even with surgery, the metal rod or the plate and screws, healing rates meaning you get x-rays periodically and you watch for the bone to heal, basically fill in with callus and become solid bone. That's somewhere between 4 to 6 months. Now, that doesn't mean that necessarily that you're back to 100% that quickly. That's just time to where on x-ray is completely solid. Can be faster than that, especially if it's the nail that goes down the center of the bone. But again, that's a good rule of thumb. In terms of returning to activity, a lot of it depends on what you're trying to do. Sports can be longer than that, 9 to 12 months or longer, because you're overcoming the weakness of the muscles around it. You're working on getting used to landing on it and running and landing from jumps and all of that. So it can take a while. Plus, everybody's different. That time frame is not an absolute. That's just based on an average of people that have gone through that surgery. There's a variety of differences in terms of like medical problems, use of steroids or anti-inflammatory medications. Is the person a smoker? And any number of things that potentially could delay that. That's generally the rule of thumb as far as getting back to activities. 4 to 6 months roughly to get that to heal, and longer than that, 9 to 12 months for sports and exercise. But it could be sooner than that, depending on what you do. More daily activities could be even sooner than that. It just really depends on what you need to be able to do. Now, if you have an injury and you want to basically hear about injuries or treatments, I should say, other than surgery, other than cortisone shots, click the link in the description under this video, fill out the contact form, and you could potentially schedule an appointment to see me as a patient. And I'd love to hear your experience with your tibia fracture, so leave those in the comments below. Just understand, if you ask a question in those comments, I can't respond and give you medical advice, but I might answer your question in a future video in this series. Make sure to subscribe to my video channel, click the bell to be notified when I release a new video and when I start my live streams like my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.